is Fox 5 News, live in Las Vegas.
7:20 right now. We all know that having diabetes greatly increases your risk of a stroke.
But did you also know that neglecting your dental hygiene can not only increase your risk of diabetes, but can also increase your risk of strokes? We have a doctor live in studio to explain next.
Hey everybody, welcome back to Fox 5 News live in Las Vegas at 7:22 right now. Did you brush your teeth this morning? Did you floss and use mouthwash? Did you also know that gum disease is worse than diabetes for causing strokes? I had no idea. Dr. David Trylovich is here to help you stay healthy. Dr. Trylovich, welcome, and thank you so much for coming in. You know, we've been talking a lot about diabetes this month. It's Diabetes Alert Month, and I've been talking about what I've been dealing with because I'm on insulin medication right now. So this was a big shocker to me. Tell me all about this.
One of the things that we've always known forever that there's been a strong link between gum disease and diabetes. And the better people can get their diabetes under control, then the better we can get them to respond as far as our treatment for gum disease.
Okay.
What we've also found out is that by getting their their gum disease under control, they can decrease their amount of medication that they take for their diabetes. So oftentimes their insulin levels will need to come down. And so when we see in gum disease, normally it's a quiet disease. It's just a quiet infection that goes on below the gum line. So most people don't even have any symptoms.
Yeah, this looks pretty gross right here.
Yeah, and normally you've got normal bone, and when you have gum disease, you start to have buildup of bacterial plaques down below the gum line. But there's been more links now linking gum disease and heart disease and gum disease and strokes.
Yeah.
And there's a recent study that came out now that showed that with gum disease, that patients that had gum disease, and depending upon the severity of the gum disease, they were 2 times more likely to have a stroke from that.
Yeah. And so what are some of the preventative things that people can do? Because this looks pretty severe. What can they do, especially those with diabetes?
The most important thing you can do is make sure that whoever you're seeing as far as your dentist is really doing a great job as far as treating your gum disease, identifying your gum disease. They should be probing around your teeth, calling off what your numbers are. You shouldn't be having bleeding when they're cleaning your teeth, or you shouldn't be having bleeding when you're brushing or flossing your teeth as well.
And what about these, the set here? These looks very healthy right now.
Yeah, these are very healthy. These are once people lose their teeth, unfortunately now they have to go into something else that's something like a denture.
Yeah.
And so when people have dentures, then now we start talking about what other options we have for them to get them out of dentures. And a big thing for if they get such a severe amount of disease, then it's oftentimes better to get rid of their dentures and now get them into something that stays in all the time.
Yeah.
We can do that now with just as simple as 4 implants to help do that.
Very nice.
And that will now take them from something that's as bulky as this to try to imagine wearing this in your mouth would be quite uncomfortable.
Yeah.
But yet now we can get them into just a set of teeth that they can now wear all the time.
Well, very nice. So how can folks get in touch with you? Do you have a website, your phone number?
We have a website that's dentalimplants.lv.com.
Okay.
Also lvperio.com, or you can just search us on Google under Trylovich.
All right, you did good. Were you a little nervous?
I was nervous.
Yeah, this is my dentist. Thank you, Dr. T. We appreciate it. All right, 7:25 right now. Jason, you're always talking about your dentist. Top that.
Yeah, well, does your dentist have a treasure chest for toys?
Oh, yes. Are you kidding?
Oh, he does?
Yeah, he does. Lots of candy. No, I'm kidding.
Yeah, candy, right. All right, thanks, guys.